Okay, so the person, again, scheduled back to the, and I keep interrupting, I apologize.
That's okay.
That the people that have been scheduled for an angiogram.
Right.
And they know that there's trouble.
Exactly. Yeah. We can help them. We can give them options. You see, I'm very concerned that that people are making medical and very important decisions from a state of fear.
Tell me about that. Tell me about that.
That's a bad situation. Let's look at how people make decisions about surgery. Let's say you want to do plastic surgery.
Okay.
Let's say you want to have arthroscopic surgery on your knee. You're not told that without this plastic surgery or without this arthroscopic surgery on your knee, you're going to die in 2 weeks.
Interesting.
But when it comes to bypass, or it comes to angioplasty, or it comes to catheterization, you're told that without us, you're going to die.
Do they say that? Do they say that?
Absolutely.
And can they say that?
There have been books written about that. There's one book by a Nobel laureate.
So they're pressured, but they're pressured.
The pressure, and it's like words that maim. And these are the words that come out of physicians' voices, in which they are terrifying patients into doing what the physician wants to do.
Okay, so the patient watching this, their loved one has been told that. What do you say to them? It's not
I
true?
I say that, number one, you should never make a decision out of fear. Period. He should show you all of the studies, statistical ramifications of the benefits to be gained from the bypass, and he should show you all the studies of options and other alternatives. Because
but if they're not going to do that, according to you, since they're not going to do that, what? Just get a second opinion.
Get a second opinion.
Go to Whitaker Wellness.
You come to us, we do not frighten people into our therapies. Patients take our therapies because they have been told what they do. They've been told about the safety of them, and they've been told about the effectiveness of them, and they do them on a rational basis, and they get better.
Okay, but if somebody, look, they have family, they have children, or maybe they're putting their children through college, and they've been told if you don't get this bypass, you're going to die, then it's pretty risky. They're going, okay, we're going to switch. It's
not risky at all. In the first place, bypass surgery has never been shown. As a matter of fact, let me rephrase that. Bypass surgery has been shown unequivocally not to prevent heart attacks or death.
Do you think it's a temporary fix?
The overwhelming majority of patients.
Is it a temporary fix?
It's not a fix.
Then why is it being done, and why is it covered by insurance? I mean, respectfully, I say that. I mean, this is so new to my ears.
Why is it being done?
Right.
Why is it covered by insurance? Because it makes a lot of money.
Really?
It is 45.
Will you get in trouble for saying these kind of things?
Well, let's put it this way. I always look both ways when I step into a street, and I'm very careful.
So you're careful with what you're saying today. But the bottom line is, I guess the main point here, and I'm not, because I don't know enough about your program to endorse it, so I want people to know that as well. But you're saying that if somebody's been diagnosed with heart disease, if somebody's been told you probably need a bypass or a stent, we haven't talked about stents, things like that, you're saying get a second opinion, because there's an alternative way that's better and more effective. Is that right?
And
am I catching you right?
Absolutely. Absolutely.
You see it every day?
Every day. Randy, I've been doing this for 30 years. I wrote that book,
Reversing Heart Disease,
23 years ago. The data hasn't changed. When I wrote that book, they already had studies showing that bypass didn't work. And if bypass didn't work, angioplasty can't work. It's not a plumbing problem. It's a lifestyle problem.
So how do you then open up these veins? Give me an example of a therapy you have in your...
All right. First, we change your diet, and everybody knows that. You eat better, you eat less, you eat more fruits and vegetables.
You outline that in your program. Okay.
So you change it. And you take a whole bunch of vitamins and minerals. That's outlined. You need to do that. Coenzyme Q10, ribose, L-arginine. There's a lot of things that you need to do. Then we have therapies that open up the blood supply.
To the heart. To the heart.
To the heart.
Like what?
And one of them is a therapy called EECP, Enhanced External Counter Pulsation. This is a therapy where patients who lie down on a bed, we put a body stocking on their lower extremity. Every time their heart beats, the body stocking compresses. The patients call it happy pants because they're jumping all around every time.
Is it like a blood pressure glove?
Well, yeah, a blood pressure cuff over the entire lower extremity.
Okay.
And now when that compression of the lower extremity shoots additional blood up into the thorax and up into the heart, it opens up the arteries. it causes collateral circulation to develop. And this is
when
not
you say collateral
just
circulation, you mean new blood flow, new
blood
veins?
flow.
Really?
New blood
You have
flow.
proof of this? I mean, can
Absolutely.
you see it in
This is
photography?
one of those therapies that we use at Whitaker Wellness. We've got one of the largest EECP centers in North America, but it's one of those therapies that conventional physicians are also using. But they don't use it very frequently because the cost of it to the patient is very low. Even Medicare and insurance companies pay for it for cardiovascular disease. But they downplay it because the business of heart surgery is so...
So since you mentioned it in your words, it's not a plumbing problem.
Right.
But in a way, you are freeing up the plumbing? You're kind of cleaning the pipes or expanding them or creating new pipes?
We are improving the circulation.
All right.
Now, when you improve the circulation, you don't improve the circulation just because you have a blockage somewhere. You see, there are a lot of people walking around with 100% blockage in the right coronary artery that didn't have a heart attack. How could they do that? Because the body built collateral circulation. They bypassed the artery in a very natural and systematic way. The body does that.
So there are people with clogged arteries that just never have an event.
They never have a heart attack. 100% blockage, no heart attack.
Because their body makes that.
The body makes the collaterals. The therapy that
no
we talked
cardiologist, no thoracic surgeon would disagree with this. Okay.
Oh, no, because they see 100% blockages all the time in patients who haven't had a heart attack. So obviously it can be done, and the only way it can be done is that the body opens up collateral circulation.
So you do this using this EECP, but that's just one of the therapies. I mean, you're not just using that.
Right.
We're going to take a quick break. Okay, so reversing heart disease naturally, cancel your bypass is your message. Is that right?
Now, get a second opinion.
Get a second opinion.
Yeah.
We'll be right back. Up next, more about what you can do to reverse heart disease. And also, Dr. Whitaker explains, and by the way, he's the founder, if you're just tuning in, of Whitaker Wellness, best-selling author of Reversing Heart Disease Naturally. And he says for even the chronically ill patients that have been given a death sentence, that also can be turned around. Is that right?
That's correct.
Okay, we'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, reversing heart disease. With us we have the author of Reversing Heart Disease, Dr. Julian Whitaker. Okay, Dr. Whitaker, for people just tuning in, you have one of the largest and, according to you, the most comprehensive heart centers in the country.
Heart treatment centers, absolutely.
Okay.
Of complementary nature or alternative nature or natural nature or wellness nature.
Now, when you say complementary, just so I'm clear on this, you're complementing what we know, what traditional medicine knows.
All of our physicians can write any prescription they wish. We can write all the drugs, but we generally are taking people off drugs.
Okay.
And we are replacing those drugs with natural therapies that actually reverse the disease process. And the disease process can be reversed.
Now, if anybody just tuning in now missed the first half of the show, we're going to have this and post this on our website because it was really good. You're saying that you can fix what they call this plumbing problem. It's being treated like a plumbing problem. That you could avoid bypass surgery, and the heart, and I want to get this right, almost heals itself.
Well,
do I have that right?
Yes, you have that absolutely right. There's no question that with the therapies that we use, that we can engender health in people who've been told to have bypass, and we can actually reduce their risk of having a heart attack to a greater extent than could the bypass. There's no question about that.
So that clogged artery, you say leave it clogged, but you have technology like the EECP machine
to improve the circulation. Correct.
That'll create
collateral
circulation.
Right.
Okay.
Around that blocked artery.
All right. Now that's one therapy. What else are you doing for the heart?
Then we have hyperbaric oxygen. Now with people that have acute heart attack, or even with strokes, or people that have chest pain, we can put them in the hyperbaric oxygen chamber. They'll breathe 100% oxygen under some pressure, and now we are oxygenating the entire heart. And it is dramatic what can happen.
But they can't do that forever.
No.
So are you healing the heart? Are you healing the heart?
Because when you do that, it stimulates the body to make other vessels. It's called angiogenesis.
So this is a 1 week program or 2 week program?
Well, 2 to 3 week program to get the hyperbaric oxygen and a full course of ECP.
Okay.
Just takes time to do those, yes.